Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Welcome, listener. Thank you for making the time to listen to this podcast. Today's podcast will introduce you to the magical world of hormones. And I will share some fewer known facts about each one of them that hopefully will leave you fascinated and will open the desire for you to know more and prompt you to ask the right questions when you see a doctor. Some of these hormones are literally absolutely fascinating. The others maybe not so much. I promise I will spend more time on the important ones. And please remember, this is just an introduction. There could be much more said about all of these hormones. So let's start. There are over 20 major hormones produced by the body. I will discuss our master key hormones and explain what they do one by one. Some deserve their own podcast, and I will tell you so when that is the case. And I will dedicate time in the future for each one of those individually. You might know that our brain and nervous system are all about communication and all about carrying the information from the brain to the body's organs. But you might not know that our endocrine system or our hormonal system also is informational. Hormones carry essential messages throughout the body, influencing every physiologic process you can think of. Hormones can be considered, and they are, chemical messengers. Some hormones have very specific actions, like insulin and glucagon, prolactin, renin, angiotensin, vasopressin. Some hormones have a very broad effect, influencing many tissues, organs, and body functions. Specifically, our sex hormones, cortisol, thyroid, growth hormone, melatonin, etc. There are 12 different endocrine glands that make hormones throughout the body. I will talk about each endocrine gland as it pertains to the hormone I'm discussing, so I can tell you where that hormone comes from. I'm pretty sure once I get into the nitty-gritty for some of these hormones and what they do, it will be more interesting. Bear with me and I'll try to make it as easygoing as possible and simplify this introduction to our body's hormones. Number one, our sex hormones. What are sex hormones? Well, sex hormones are produced by the ovary in women and by the testes in men. There are three major sex hormones in women: estrogen, progesterone, and testosterone. There is one main sex hormone in men, testosterone. Why am I starting with sex hormones, and why do I consider them number one? Sex hormones determine, control, and regulate our sexuality and fertility, but they're also absolutely crucial for our overall health and balance. Sex hormones influence everything in our body, our physical and mental well-being. How do they act? Sex hormones act by targeting and linking with receptors. Remember this word, receptors, on various cells and tissues throughout the body. In the future podcast, when I'll talk about estrogen, progesterone, testosterone, we will talk again and again about receptors and how there are receptor disruptors and how the hormones might be fine, but the receptors are not. So please remember that sex hormones have to act by targeting and linking with specific receptors. And again, if you thought that all they do is related to sex, you could not be further from the truth. They critically influence our reproductive and urinary organs. You might know that estrogen and progesterone are crucial for uterine, vaginal, and urinary health. And you might know that testosterone is vital for the normal functioning of the male reproductive organs like the penis, the testicles, and the prostate. But you might not know the facts that sex hormones also affect, control, and influence many other tissues, like our bones, our skin and joints, our blood vessels, our heart, our brain. They have a very profound effect on our mood and cognition. They affect our kidneys and lungs, thyroid, and immune system. So they pretty much go everywhere and control and regulate many key functions in the human body. I can honestly say that sex hormones might be the most important hormones that the human body produces from an anti-aging standpoint. And why do I say that? Well, because number one, we only make them when we're young. And once they're gone, we do not feel good and we age rapidly and drastically. And number two, because they literally rejuvenate everything once we start replacing them. I will tell you more on how exactly they do that in the future, so please stay tuned. Number two, our thyroid hormones. They're made by the thyroid gland. Thyroid hormones control our metabolism, how we use our food, control our temperature, our blood pressure, and body's reaction to other hormones. They are produced by the thyroid gland located in the front of the neck. Our thyroid is the master regulator of our metabolism. Thyroid hormones are crucial to maintain our body's normal weight. Thyroid hormones influence all the other key hormones, and they work together to keep the body healthy and in balance. You might not know that thyroid influences and controls our sex hormones. Everything in the body is related, and everything is interconnected. For example, if your thyroid is off and you're a woman, your periods will be abnormal. They might stop completely. If your thyroid is too low, it will directly impact your fertility potential. And if you do get pregnant, you might have a higher risk of miscarriage and stillbirth and place your unborn baby at risk for a low IQ. Normal thyroid function in a woman is key to a normal developing fetus. All fertility doctors know this, so first thing they will look at is your thyroid and make sure that it is addressed before any fertility treatment is started, as the chance of success is greater with a normal thyroid. If you're a man and you have a low thyroid, your ability to circulate adequate amounts of testosterone into the blood might be impaired, and you can have symptoms of low testosterone by simply having a low thyroid. Thyroid and adrenal work together to regulate the energetic needs the body has, and adrenal is next on our list. Thyroid regulates energetic needs day to day, 24 hours, 7 days a week. The adrenal gland regulates our energetic emergency needs by producing cortisol and catecholamines. It is responsible for our awakening response in early morning, caused by the initial surge of cortisol release. So the body wakes up, there is a surge of cortisol, our stress hormone, which is the adaptation to environment hormone as well. And the adrenal is also responsible for more surges of cortisol and catecholamines throughout the day, as demanded by various stressful stimuli and situations. We probably can live without a thyroid, but not well, and it will be a life that's far from its full potential. It will be the type of life where you drag through the day, where nothing works well, your energy, your mood, your weight, your health, everything continues to deteriorate more and more to the point where the body could possibly be breaking down completely. There's so much to talk about the thyroid. I will dedicate a podcast not too far away in the future about it. But before I move on to the next hormone, I'd like to discuss a very little known fact by most people, and one of my biggest pet peeves that annoys me a lot about how conventional medicine manages thyroid problems is how to test for a thyroid. This is a very small preview of what I will discuss in the thyroid podcast, so I will keep it simple. Ordering TSH only and telling the patients that their thyroid has been checked and normal is very, very misleading. Just a few words about how thyroid works to make it easy for you to understand thyroid hormone testing. The thyroid produces two key hormones, T4 and T3. The thyroid hormone production is regulated by two other hormones made by the brain, TSH and TRH. TSH means thyroid stimulating hormone. It's made by the pituitary gland located at the bottom of our brain. The thyroid is under the direct influence of TSH, and TSH is under the direct influence of the brain, specifically the hypothalamus area, where TRH is being made. TRH stands for thyrotrope releasing hormone. So there is a chain reaction from the brain to the pituitary to the thyroid. Again, the communication is TRH to TSH to T3, T4 production. So it's mind-boggling why doctors are simply checking TSH and not checking thyroid hormones. TSH is a pituitary hormone, not a thyroid hormone. Again, more to come, more of an explanation in the future. But please ask your doctor to check actual thyroid hormones and not TSH only. Number 3, our adrenal hormones. Well, I could talk about this for a couple of podcasts, so let's keep it simple and stick to the facts for the purpose of this introduction. Adrenal hormones are made in the adrenal glands. These are very small walnut-sized glands located on top of each kidney, one for each side of the body. They produce some major key hormones that have broad but also very specific effects on the body. Cortisol, the stress hormone, aldosterone, regulating salt and water balance and blood pressure, DHEA, a prohormone that converts to sex hormones in both men and women, and last but not least, adrenaline and noradrenaline, also known as catecholamines, the fight or flight response hormones. The same as thyroid, our cortisol production by the adrenal gland has to be just right. And modern medicine does not address thyroid or adrenal insufficiency properly. More to come on that in the future, but let me give you some basic facts. Let's start with cortisol. Cortisol is made by the reticular zone of the adrenal. It is a key master hormone, essential for our survival and well-being. A physician called Dr. Wilson coined the term adrenal fatigue. It's very popular with patients, as many of them have heard about this, and it's pretty easy to understand. There's something wrong with your adrenal, it's probably fatigued. So they come to the office and they're asking to be tested for adrenal fatigue. Obviously, as a physician, you probably have to know a little bit about adrenal fatigue. Or if you've never heard of it, you probably should start reading about it. The problem is modern medicine disputes the use of this term, and conventional medicine doctors and endocrinologists alike do not believe that this term should be used at all. And there's a reason for it, because the reality is the adrenal does not get completely fatigued in the sense of fatigue, but the adrenal can become dysfunctional. Modern medicine recognizes very specific adrenal pathology that has been described for over 100 years ago by the forefathers of medicine. Modern medicine refuses to look at it from a fresh perspective, which is disappointing. If a patient presents with very low adrenal hormones, that's called Addison disease, and it's usually an autoimmune process. The name comes from the doctor who first described it in 1855, a long time ago. The opposite of low overall adrenal function is an excess of adrenal hormones, and some of them can be very specifically in excess, like cortisol excess. That's called Cushing's disease. And again, that's based on the name of the person who first described it in the early 1900s. So for modern medicine to say that between Addison's disease, which is complete total lack of adrenal function, and Cushing's disease, a severe hyperfunction of cortisol, there's nothing in between. To negate the advances made by modern medicine and modern technology testing, that there is something in between those two extremes that qualifies and is felt as a problem, doesn't make sense to me or to other doctors who are also dealing with patients who face this problem. It also doesn't make sense to the patients themselves, who feel dismissed, belittled, and disrespected by being told that adrenal fatigue does not exist. I personally do know that adrenal fatigue does exist because I experienced it myself. And Dr. Wilson used the term to simply make it easy for a regular person to comprehend the fact that their response of cortisol is no longer perfectly normal. Let me explain what I mean by that. The diurnal response of cortisol consists in the fact that normally the adrenal will release cortisol with a significant surge in the morning. Remember, cortisol is also an awakening hormone. It's an adaptation to environment hormone. It's the hormone that literally gets us up in the morning. There's a significant surge of cortisol in the morning that slowly declines throughout the day and becomes very low at nighttime, which allows us to fall asleep. This diurnal pattern can be dysfunctional, and we can talk more about it in the adrenal podcast, so please stay tuned. This adrenal pattern of cortisol release can be tested. And if your doctor does not want to test your cortisol response, there are many labs that allow you to pay cash and submit a saliva sample 4 times throughout the day, plotting a cortisol response curve and giving you an idea if you're dealing with an imbalance. Let's move on to the next hormone produced by the adrenal glands, aldosterone. It is called a mineralocorticoid hormone and is produced by the glomerular zone of the adrenal. It is in charge of regulating water and sodium balance and is crucial for maintaining our blood pressure. The amount of water we have in our bodies circulate through our blood vessels to ultimately be filtered through the kidneys and eliminated through the urine. What happens if you're dehydrated? Well, your blood pressure will be low. What happens if you retain or have too much water? Your blood pressure will be high. One of the major classes of antihypertensive medication are called diuretics because they lower total blood volume by eliminating excess water, lowering our blood pressure effectively. Keep in mind, coming back to cortisol a little bit, cortisol influences our blood pressure profoundly. People with adrenal insufficiency and cortisol deficiency will have hypotension and feel dizzy a lot, especially with big changes in position. And people with adrenal overproduction will develop high blood pressure. The third hormone made by the adrenal is DHEA. DHEA has many benefits, and a lot of research has been done about it, and is considered a critical anti-aging and anti-inflammatory prohormone. Its main role, however, is to convert to androgens in men and to convert to estrogen and androgens in women. It's sort of a very small reserve the body has in case sex hormones are deficient. And it's very important after menopause when ovaries stop producing estrogen completely. And if the body has a good reserve of DHEA, a woman might have a much better menopause experience than someone whose DHEA is completely depleted and low. There's a lot to be said about DHEA and its anti-aging properties. What is interesting and what not many people know is that too much DHEA could be a problem. And let's talk about that for a second because many of you might have heard about DHEA and many of you are possibly taking it as a supplement. In case you don't know, DHEA is a supplement sold over the counter without any regulatory oversight or specific recommendations of maximum dose. Keep in mind the body makes about 25 to 40 milligrams of DHEA daily maximum, and the amount of DHEA will significantly decline with age. Taking more than about 25 milligrams of DHEA does not make any sense. So please make sure that if you decide to take DHEA, you discuss this with a physician, have a DHEA blood level tested so you have a baseline, and you might as well test your cortisol and pregnenolone to get a good sense of what's really happening with your adrenal. So DHEA could come in very handy, especially in young women who might suffer from low DHEA. Lots of young women have adrenal problems caused by stress, and they might wish to feel better, or they might wish to increase their libido or their fertility. So it is important to use DHEA responsibly, though. Fertility doctors use 25 milligrams of DHEA daily to boost a good ovarian reserve, and especially to boost ovarian response to fertility drugs. But it's not for a long time, maximum 6 months. So what happens if we take too much of this very important prohormone, which, by the way, it's not regulated in any way, shape, or form? Well, it might come as a shock to you because DHEA is really a critical, very important prohormone. So you might think, well, what could be wrong if I take a lot of it? Well, two things can happen. Taking large amounts of DHEA for a prolonged period of time, especially more than 6 months to a year, could increase your risk of sex hormone-sensitive cancers like breast cancer. So be careful about that. And number two, taking high doses of DHEA can mess with your mood and cause rage and behavioral problems. So before you use DHEA, please consider getting a proper evaluation and testing. The last but not least of the hormones produced by the adrenal are adrenaline and noradrenaline. They're also called catecholamines, and they are essential hormones for not just our endocrine hormonal system, but they're also neurotransmitters for our nervous system. They are released by the medullary zone of the adrenal gland as a surge in response to stress, or more specifically, to what we perceive as stress. These are our fight or flight response hormones. And the stress response includes other hormones as well. And just the stress response itself would be an excellent topic for a podcast, so I won't dwell on it for now. What you need to know is that these hormones are also essential for survival. Their role is to increase heart rate and blood pressure to allow blood to flood our brain to think quickly and generate quick action, and also allows blood and oxygen to flood our muscles so we can run quickly away from danger. Number 4, insulin and glucagon. These are our sugar regulating hormones. They're made in the pancreas, an organ located in the abdomen, and they are master key hormones regulating our blood sugar. Insulin lowers blood sugar by allowing it to enter our cells, and we use it as fuel. Glucagon raises blood sugar by mobilizing it from our cells for moments where we need high levels of circulating carbs as fuel. Insulin is crucial for our survival. Without it, we die. This hormone is so important that it deserves to have its own podcast. But I would like to take a little bit of time here to discuss it, as many people don't know about prediabetes, insulin resistance, how to diagnose diabetes, and so on and so forth. Some very basic facts about insulin are that it interacts with the body via receptors. Remember, I told you at the beginning, remember this word, receptors? So the receptor for insulin and for any other hormone, it's like a key and lock mechanism. The cells have specific receptors with a specific structure that the insulin or another hormone, for example, will have to attach to activate this receptor, unlock it, and allow cellular action. So the insulin interacts with the body via receptors. So there are 2 types of disease caused by insulin issues. Number 1, the amount of insulin released, it's either too low or too high. And number 2, the receptor for insulin is broken, and now we have what is called insulin resistance. Let's talk about number 1, too little or too much insulin. A deficiency of insulin is by definition type 1 diabetes. That is a very specific type of diabetes that usually occurs when some form of disease destroys the normal pancreatic tissue. For example, a tumor, a cancer, an autoimmune process, or an infection. One of my very good friends and a respected acupuncturist died of pancreatic cancer and came to me asking help in diagnosing his condition. He suspected pancreatic cancer, and unfortunately, I knew he had cancer before his test results came back to indicate the tumor marker for pancreatic cancer, because his blood test initially showed severe uncontrolled diabetes. This was a fit, lean, thin man who was eating healthy and exercised daily, and he had just been suffering severe abdominal pain for the past couple of months. It was an aggressive cancer, and it destroyed his pancreas pretty quickly, so there were no more cells to make insulin. Again, that can happen if the pancreas is attacked by a virus or an autoimmune process, and this is type 1 diabetes. So what happens if we have too much insulin? Well, that depends. If the insulin levels are high because of a tumor causing an overproduction of insulin, that's usually called insulinoma, then the people who experience that will always have low blood sugar and will always experience permanent, persistent anxiety and hunger. If the insulin levels are high because of insulin resistance, then the excess insulin will result in chronic high blood sugar, which will lead to diabetes. This is type 2 diabetes. So type 2 diabetes is related to obesity and starts with an excess of insulin due to a broken insulin receptor process. More on this and how to reverse it in a future podcast. We'll keep moving on to review more of our body's hormones. Number 5, our growth hormone. It's produced by the pituitary gland and is responsible for the growth spurt in children and adolescents. Also controls the adult's body composition and unfortunately declines with age. Please remember, growth hormone, it's an absolutely essential anti-aging hormone. A deficiency of this hormone does not feel good. Adult onset deficiency of human growth hormone, which pretty much applies to everyone after 50 or 60, is accompanied by a reduced sense of well-being, very low energy levels, sometimes chronic fatigue, excess fat around the midsection or what we call belly fat or the spare tire, loss of muscle mass, muscle tone and weakness, mood changes like anxiety or depression, insulin resistance, which of course increases the risk of type 2 diabetes, decreased bone density, which can lead to osteoporosis, and more. There's a lot to say about this very important master hormone and its value in any anti-aging regimen. I will dedicate a podcast in the future to the growth hormone and how to stimulate growth hormone production in the body as we age. I promise. Number 6, melatonin. Who has not heard of melatonin? It is our sleep hormone produced by our pineal gland, and this is a little gland located in the middle of the brain, and the production of melatonin comes in response to darkness. But this hormone is so much more than just our sleep hormone. It's a very strong antioxidant, so strong as a matter of fact that it's considered by some to be more potent than glutathione and vitamin C. Research shows that melatonin has a strong ability to scavenge toxic free radicals. This is just one of the many actions that also makes this hormone have very potent anti-inflammatory effects. There's compelling evidence that melatonin helps our ability to fight cancer and has anti-cancer effects. Melatonin is sold over the counter, again, same as DHEA, with no regulatory oversight. So keep in mind, if you take too much, it could make it very hard to sleep. You can actually feel groggy throughout the day and tired. And too much melatonin can give you nightmares and possibly nausea throughout the day. Most healthcare professionals agree that the maximum dose should not exceed 10 milligrams, but most people usually start at 1 to 2 milligrams at night. I have a couple more, I promise. Number 7, oxytocin. This is produced by the brain area called hypothalamus. Oxytocin stimulates contraction of the uterus during labor, allowing for vaginal birth at the end of pregnancy. Everybody knows that, but you might not know that it is also called the love hormone. The brain releases massive amounts of it during orgasm and sexual stimulation. It is a hormone that overall promotes positive feelings. It can have an anti-anxiety effect, and it can decrease social-related anxiety. It is known as a social bonding hormone and can motivate a person to choose their partner over a stranger. Oxytocin can trigger feelings of love and protection. It can strengthen empathy and trust, especially when parents and children interact with one another, or a man and a woman who are partners look at each other or engage in physical touching or embracing. How does oxytocin deficiency manifest? Likely with poor communication, irritability around others, inability to feel affectionate towards others, possibly with excess anxiety and various fears, maybe difficulty achieving orgasm. And in people with oxytocin deficiency, sex is more about fulfilling a basic need than about bonding. There might be disturbed sleep and not feeling much joy from life in general. It sounds like a great hormone to have, and it would be great to know what our oxytocin levels are throughout the body and as we age. But unfortunately, there is no way to test oxytocin. Testing for oxytocin is not widely available and is generally only used for research purposes. However, discuss whether your symptoms might be due to oxytocin deficiency with a knowledgeable physician and consider a trial of oxytocin to see if it helps your symptoms. Number 8, prolactin. We're going to be very brief because this is produced by the pituitary gland at the bottom of the brain, and it mainly initiates and maintains milk secretion in the breasts for lactation purposes during breastfeeding. However, too much prolactin will cause a disturbance in a woman's periods, infertility, and a prolactin level should always be checked if a woman has breast discharge outside of pregnancy from both breasts. The same in men. Men should never have breast discharge from their breasts. Keep in mind, if there is a breast discharge in a woman and only from one breast, that could have a totally different meaning and could be much more concerning than just elevated prolactin, raising the possibility of malignancy in that specific breast. Couple more hormones, we're almost there. Number 9, parathyroid hormones are produced by the very small parathyroid glands located near the thyroid gland. They simply regulate calcium levels. Number 10, the antidiuretic hormone, also known as vasopressin, helps constrict our blood vessels and maintain normal blood pressure. It helps the kidneys control the amount of water and salt that exists at any given time in the body. It is produced by the hypothalamus, an area in the brain. This important hormone is released if the concentration of salt in our blood increases. For example, when we are dehydrated. Feeling thirsty or having nausea and vomiting would also promote release of this hormone, as it acts to keep up the volume of fluid that is lost by being in a hot environment and sweating or by vomiting. Number 11 and 12, renin produced by the kidneys and angiotensin produced by the liver. Both of these are involved in blood pressure control. These hormones are critical regulators of blood volume and electrolyte balance, and they control overall vascular tone and resistance. If our blood pressure is too low, the body will make more renin, and the renin will activate the angiotensin to increase blood pressure. Some antihypertensive classes of medications target specifically the angiotensin-converting enzyme, decreasing angiotensin release so the high blood pressure will be corrected. Number 13, erythropoietin, produced by our kidneys, affects red blood cell production. Chronic kidney disease that affects the production of erythropoietin will cause anemia. That's why many people that are on dialysis or have kidney insufficiency have anemia. Anemia manifests with fatigue, dizziness, palpitations, pale skin, and generalized weakness. Number 14, ghrelin and leptin. These are two very important hormones involved in the regulation of our appetite, what we call hunger and feeling full. Ghrelin is made in our stomach and is involved in sending signals to the brain to tell it to stimulate appetite and create the sensation of hunger. Leptin, on the other hand, is produced by our fat cells and suppresses food intake, contributing to weight loss. These two hormones work together to control our appetite, and they are involved in the vast and complicated network of various metabolic pathways that ultimately control and regulate our weight. Many obese patients do not know that these two hormones exist, and it's not very easy to test for ghrelin and leptin levels. However, have a consultation with a knowledgeable physician to discuss whether or not you might be suffering from a ghrelin or leptin imbalance. The last but not least, number 15, 3 hormones produced by the thymus: thymulin, thymopoietin, and thymosin. These hormones regulate various immune system functions. Again, our thymus gland is a very small gland located in our chest, behind our sternum. It's only active from childhood until adolescence. It significantly diminishes and atrophies with aging. But this very small gland produces and trains our T cells, also called thymus-derived lymphocytes. And these T cells are very important in defending us from foreign attacks caused by bacteria, viruses, parasites, toxins, even cancer cells. That was the last of our hormones in the master key hormone introduction. Please remember and keep in mind, everything in the body is connected via nerves, blood vessels, and hormones. Our endocrine hormonal system is spread throughout the body in key positions, and it interacts with the body in an absolutely vital way that is necessary for survival and crucial to be in perfect balance for optimal well-being. As a quick recap, here are the following organs in our body that make hormones: the hypothalamus, the pituitary gland, and the pineal gland. They're located in the brain. The thyroid and the parathyroids located in the neck. The thymus located in the chest. The stomach, the kidneys, the adrenals, and the pancreas located in the abdominal cavity. And last but not least, ovaries and testes located in the pelvic region for a woman and the scrotum for a man. That is 12 organs that make hormones. There are many more hormones that I have not covered in this podcast. For example, all the pituitary hormones that regulate and control other major hormones. I mentioned TSH, thyroid-stimulating hormone, but there's also FSH, follicular-stimulating hormone, and LH, luteinizing hormones. Those regulate the ovary and the testicles. There's also ACTH, regulating cortisol and adrenal in general. Also keep in mind, our pituitary gland makes major hormones like growth hormone, prolactin, vasopressin, oxytocin. It also releases endorphins, and it is a master regulator for our endocrine system. Holds a key position as a connector between the brain and various organs, including our genital organs. In many circumstances, the pituitary is the key, but it will constantly be overlooked in the workup of hormonal issues. Only an MRI with the pituitary focus can detect and diagnose pituitary abnormalities like tumors. This podcast is drawing to an end, and in conclusion, I'd like for you to remember that our endocrine hormonal system is extremely complex. It's made up of various glands that make hormones. The hormones are essentially the body's chemical messengers transmitting information from one cell to another. Remember, our hormones influence almost every cell, every organ, and every function our body has. Well, hopefully this was not a very boring lecture and you learned something new. I know I've discussed a lot of things and I introduced you to many hormones, and I might have generated more questions than provided answers, especially where thyroid and adrenal and sex hormones are concerned, but I promise I will come back. Each one of these master hormones deserves its own podcast because you deserve to be in the know and be educated. So I'll come back and talk more about these in future podcasts. Thank you for listening. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.